All right, fluid and electrolytes part two. So we're picking right back up with fluid volume excess. Again, you see this in, it can be seen in the distended neck veins, edema. You can hear it in the lungs via crackles. So it's important that we measure INOs and daily weights, that we're listening to the lung sounds frequently throughout our shift, that we're assessing for edema and shortness of breath and other symptoms that indicate that there is too much fluid on board. We're going to monitor the response to the medications we're giving, diuretics such as furosemide, as well as the fluids we're giving to the patient, making sure that they do not go to the lungs. We are going to put the patient on a fluid restriction of about 1,200 to 1,500 milliliters per day. Of course, the physician determines the exact amount. As the nurse, we need to monitor and make sure the patient's adhering to this, as well as the family members, not bringing in outside fluids and foods. We're going to also do lots of education to the patient related to sodium, hidden sodiums, as we mentioned before, in TV dinners and other like takeout food has a lot of sodium, hidden sodiums. And then as well as they're going to need to do the fluid restrictions when they get back home too. We're going to monitor and make sure that their diet while in the hospital is the cardiac diet, which is the low sodium diet. And we're going to make sure that the patient's educated on their medications and what they need to do when they're discharged at home. And then we're going to promote rest. We're going to tell our patient to rest really well and make sure that they're conserving their energy, because with this excess fluid on board, it's going to taxi all the organs in the body. I apologize for my dog barking in the background. Okay, here's a picture of the different IV solutions. This is a really good slide. Make sure you know this slide well for your exam. It will list out the type of solution. Look at the left-hand column on the grid, as well as what we use it for, the types of patients we use it for, and the miscellaneous is really, really valuable information. So look this over and know it really well. So looking at isotonic solutions, we are only expanding the ECF. The ECF, remember, that is the fluid outside the cells, extracellular fluid, which would include the interstitial fluid, which is the fluid in the tissues, as well as the intravascular fluid, and that's the watery plasma or serum portion of the blood. So again, isotonic solutions only expand the ECF. They don't impact the ICF, or the intracellular fluid, the fluid inside the cells, which of course is the greatest portion of water in the body. So we're going to give isotonic solutions to patients who have extracellular losses. So we're going to replace those losses with this fluid. Or we also give isotonic solutions when we want to expand the intravascular volume. Those are the situations where we give this type of fluid. Hypotonic solutions contain less salt concentration than our cells, so it provides more water than our electrolytes, which dilutes the ECF. With hypotonic solutions, we have movement of water from the ECF to the cells, the ICF. So we're providing free water for cellular hydration and renal excretion. Hypotonic solutions are used to provide free water and treat cellular dehydration. Cellular dehydration specifically. We know hypotonic solutions provide a greater amount of water than electrolytes and have decreased osmotic pressure. This causes an increase in the ICF. The fluid will leave the intravascular space and rehydrate the cells. These solutions also provide waste elimination by the kidneys. So one example of a hypotonic solution is D5W. D5W, also 0.45 sodium chloride, which we commonly refer to as half normal saline. D5W is an example of a hypotonic solution. It does not provide any electrolytes. It is isotonic on initial administration, but the body utilizes the small amount of dextrose that's in it right away, and then within like 5 minutes it provides free water for renal excretion and will leave the intravascular space to expand the intracellular fluid volume. So again, we consider D5W a hypotonic solution. Please note a couple things about hypotonic solutions. Hypotonic solutions should be given at a slower rate than isotonic solution, and it's one of the best guides to a safe rate of flow is the reaction of the patient. So when we're trying to determine at what rate to give the solution, we want to watch our patients closely, right? We need to observe for signs and symptoms of problems. For example, shortness of breath. Coughing is an indication that the patient's choking on secretions that are going to the lungs. Cyanosis. Look for the increase in respiratory rate, which is the compensatory mechanism when there's something going wrong, when the fluid's going to the lungs. Another thing is we don't want to give hypotonic solutions to patients with intracranial pressure because it increases cerebral edema. So again, do not give it to patients who have ICP because it will just cause additional intracranial pressure and edema in that area. Also, it is not given to patients who third space their fluid. So we need to look for that as well. And one final note, maintenance fluids are usually hypotonic solutions because normal daily losses are typically hypotonic. And that's why we will give hypotonic solutions for normal maintenance fluids. The next solution we're going to look at is hypertonic solutions. They contain a higher salt concentration than the cell. As a result, a hypertonic solution will move the fluid out of the cell to where the concentration is higher. It draws water out of the cells from the ICF into the ECF, raising the osmolarity of the ECF and expanding it. Therefore, it causes the cells to shrink. Hypertonic solutions must be administered slowly and with extreme caution because they may cause dangerous intravascular volume overload or pulmonary edema. So when we give these type of fluids, hypertonic solutions, we need to provide frequent monitoring of the blood pressure, the lung sounds, as well as the serum sodium levels. We do not give hypertonic solutions to patients who have kidney disease or heart disease, or to patients who are dehydrated. And we want to be continually assessing for hypovolemia for these patients. So again, we are going to give hypertonic fluids to patients to treat hypotonic dehydration. For example, patients who have severe hyponatremia. All right, some solution tips to remember. Isotonic fluids are given when fluid is lost or removed from the body. Hypotonic solutions cause expansion because they soak up the fluid around them, right? Our cells, remember, can only expand so much, so we got to be careful that we're not expanding to the point where the cells burst. And then hypertonic solutions literally will do what will pickle a patient or cucumber, meaning that we give hypertonic solutions when we need edema fluid to return back to the vasculature and to be urinated out of the body via the kidneys and the bladder. All right, we're going into electrolytes now. You do need to know the normal bases of all the electrolytes: sodium, chloride, magnesium, calcium, and potassium. You need to know each of these when there is too little or hypo, and when there's too much, hyper. So make sure that you're looking through this PowerPoint and studying, for example, sodium. You need to know that it is the major cation of the ECF, that it does influence the distribution of water throughout the body, that it is maintained in the ECF, and that it is excreted mainly by the kidneys, and you do need to know the normals for all of it. So please look through this PowerPoint, and I have literally laid out all of the information that you need to know for each of the electrolytes when there is a lack of electrolytes, hypo, and when there's too much of that electrolyte. So look through each of these and make sure that you know how a patient presents when there's too little of a certain electrolyte, as well as when there's too much of electrolyte. And you'll notice that I also list what causes those imbalances in the electrolyte, and how your patient's going to present, as well as what we do to fix the problem. And finally, look at the last slide of this PowerPoint presentation, and it lists out each nutrient and what types of foods we're going to encourage the patient to either eat if they're deficient in this nutrient, or to avoid if they're having too much of that nutrient. I also list out what the signs and symptoms are for patients who have deficiencies with these nutrients. So again, we can educate our patients if they have a lack of magnesium in their diet. It'll present, for example, with muscle cramps, nausea, and some confusion. So it's important as well to educate the family members about these signs and symptoms, as well as what foods to encourage their loved ones to eat. Halibut, pumpkin seeds, and spinach if they're lacking magnesium. Okay, so that's it. Good luck on your exam this week, and please email me if you have any questions or concerns. Talk soon. Good luck.